Hey everyone, how you doing today? It's the OG RN coming at you tonight. I thought I would just join you in YouTube and chat with you a little bit about pancreatitis. How do you like these black and white effects? I actually like the black and white effect because I feel like you don't have to worry about colors and things that are matching, and it's just so like old school classic. So I kind of like this. But let's talk about pancreatitis for a moment. So when you are studying about pancreatitis or have a patient with pancreatitis, you need to take it very seriously. Um, Patients who get gallstones are at risk for pancreatitis. So if a patient gets a gallstone um, stuck in their common bile duct, as you can recall from A&P, the common bile duct and the pancreatic duct and the bile duct join together for the common bile duct that enters into your duodenum. And if that is occluded with a gallstone, the digestive enzymes can all back up into the pancreas. And you know that when you eat meats and proteins and chicken and whatnot, your pancreas is like a powerhouse of digestive enzymes that gets released into your small intestine to help you digest and break those down to their basic building blocks, like lipids for fats and amino acids for proteins, and of course glucose for carbohydrates. So if those enzymes can't get into the duodenum and are occluded in the common bile duct by a gallstone, you need to understand that those enzymes will back up, and literally the pancreas will begin to digest itself. I mean, it'll treat itself like organ meat, and it will begin to start digesting itself. This is very, very dangerous, as you can imagine, because microscopically, when it starts digesting itself, it bursts up all the capillaries and the vascular bed that is involved in the pancreas itself. And when it does that, your patients can really have some internal bleeding that can happen very rapidly without you picking it up. And the reason I think this is so important for nurses, new nurses, nursing students, and even experienced nurses is because patients can't tell you what's wrong with them. You won't be able to tell what's wrong. You have to always kind of be looking for it and thinking it could happen. See, that's the nursing, process is they have the potential for this. So you always have to be on the lookout to know that they're at risk for it and to mitigate that risk and or at least recognize it ASAP. So, the patient, unfortunately, if they're going to have some pain, some serious abdominal epigastric pain, also radiating to the left breast and back. If it's pancreatitis, also if it's the gallbladder, it can also go radiate to the right upper quad here and to the right shoulder, can, referred pain that way. So, if the gallbladder is the main, offender. So you can have this, very interesting epigastric pain. Now, when the patient complains of any kind of epigastric pain, any pain between the chin and the belly button, they get an EKG, whether you like it or not. You can't go wrong. It is a non-invasive, honestly, very inexpensive paper test that gives a lot of information. So please don't just dismiss and assume it's GI related. Do the EKG. You can never go wrong. Get an EKG because, from the mouth to the belly button, the jaw to the belly button, you earn an EKG. So in any event, the patient unfortunately will have severe pain, and they will then begin to have the signs of bleeding. Of course, you might notice a little bit of increased tachycardia, a little increase in the respiratory rate if you're really being watchful about that. Again, hypotension is a late sign when the body can no longer compensate. So it's the tachycardia, the pain, the restlessness, the poor perfusion that's going on in the cerebral, the head. So if you don't have great perfusion because you're losing some blood somewhere in the body, you start acting restless, maybe confused, but just agitated. And then you always want to be looked for retroperitoneal bleeding. I mean, I have stories, but This could take all day if I told you all the stories, but you absolutely need to sit people up with abdominal pain and look at their posterior flanks on the back, because people are going to lay there in the bed and they're going to say, hey, I'm bleeding internally. Just thought I'd let you know. It doesn't happen that way. And they're sitting in these beds and in these structures in hospitals. And if they are bleeding internally in their abdominal cavity, gravity pulls it to the back posteriorly. So you got to sit these folks up and look for any kind of, ecchymosis or any kind of problems that way. When you turn them over and look at the back, and if you see any bruising, they call it gray Turner sign, because you had to turn them over to find it. No, it's the names of the people who discovered that years ago, but they call it gray Turners. So you'd always be assessing for that. You'd be mindful of the labs, of course, the amylase, lipase labs for the pancreas, of course, the H&H. Make sure that they're not dropping, or compare their morning hemoglobin and or the previous day's hemoglobin to now. Might have to get a stat H&H. But in any event, it's very important that you are on this potential microscopic bleeding in the pancreas, because when those digestive enzymes, worst case scenario, begin to digest the pancreas, it'll start seeping out into the free tissue around there, the free space, and into other tissues around there. And of course, that inflammation in that area will really, really then be out of control. And that's when, demise certainly can be imminent if it's not picked up timely. And your patient will then have like the left lower lobe crackles, and that's where it's all that inflammation is going to be on that patient's left lower lobe. And if it really gets out of control, they can auto-digest their own diaphragm. Because you think about it, like, people eat organ meat all the time, liver or whatever, and we, eat meat. So if these digestive enzymes just keep going, they will begin to digest anything in their path. And that's when you really can get into horrible trouble with ARDS and increased mortality. So pancreatitis needs to be taken pretty darn seriously. And you also need to be mindful of gallstones being a huge culprit in that. And they're not as benign as you might want to think that they are. Be on the lookout also for the pancreatitis. All right, see you in the next one. Please like, please subscribe.